So next is post-op fever. It's V37. So you're asked to review a 60-year-old male 3 days post-op following an endovascular repair of his abdominal aortic aneurysm, and he is now febrile, 38.2 degrees centigrade. What do you do? So I will approach the patient with ABC protocol. I will check his airway and start high flow oxygen. I will check his breathing, escalate his chest, edit sound, and then I will go for circulation, look at his pulse, rhythm, rate, and measure his blood pressure and do his ECG. And then I will look his drug chart, what medicines he's got, pain relief, fluid, other medications, and then I will thoroughly examine the patient from head to toe, and looking for any source of abscess, like in the there are 7 C's, anything in the wound, chest, any line infection, clunar infection, any collection inside, any clot in the legs, or any infection in the urine. And then I will do a sepsis 6 for the patient. So I will give free fluids, I will give IVIs, oxygen and antibiotics, and I will take blood culture, take lactate, and measure his urine output. And then I will review his past medical history, drug history, operation notes, problems during operation, and review the results of the test. What are the common causes of post-operative fever? So again, 7 C's. So cut means wound, chest means chest infection, cannula site infection, catheter site infection, central line infection, collection inside or anywhere in the body, and clot in the legs. So causes of fever immediate after operation, it could be thyrotoxicosis, thyroid storm, or Addisonian crisis. Day 0 to 2, atelectasis, broncho reaction to blended material, and day 3 to 5, UTI, bronchopneumonia, 5 to 7, wound infection, abscess and osmotic leak, day 7 to 10, deep vein thrombosis, anytime, line sepsis, transfusion reaction, and drug reaction. What is SIRS? SIRS means systemic inflammatory response syndrome. If someone has heart rate more than 90, temperature less than 36, more than 38, white cells more than 10, less than 4, or respiratory rate more than 20, or partial pressure of carbon dioxide less than 32, it's labeled as a SIRS. Any of 2 is labeled as a SIRS. This is caused by cytokine release in relation to the trauma, inflammation, and infections. SIRS criteria are non-specific and must be interpreted within the clinical. What is the difference between SIRS and sepsis? So SIRS is a systemic inflammatory SIRS is triggered by trauma, inflammation, or infection leading to organ dysfunction, organ failure, and death. And SIRS has many potential triggers, and SIRS is a physiological state. Sepsis is a physiological state of SIRS in the presence of a known infection. What common condition can cause SIRS? So it could be infective, non-infective, including burns, bleeding, trauma, pancreatitis, ischemia, and complication of aortic aneurysm, adrenal insufficiency, drugs, pulmonary embolism, and cardiac tamponade. What complication can SIRS can lead to? End organ damage, acute lung injury, acute kidney injury, multiple organ dysfunction syndrome, and shock. Thank you.